everyone. So good afternoon. My name is Dr. Roland Zhang. I am a former graduate of St. James School of Medicine and current USMLE counselor of St. James as well. I hope everyone's doing well today. Joining me this wonderful evening, I have the lovely Megan. Good evening, Megan. Would you like to say hi?
Hi, good evening. It's nice to see you today. I am the social media specialist for St. James School of Medicine. So thank you to everyone who participated in our USMLE prep questions. We really enjoy your answers and seeing your explanation. But today we wanted to bring you a recorded video since it's Christmas on what the answer for last week's question was and the explanation to the other answer selections.
Cool. So today we're talking about a 70-year-old male with a neck mass. For the clinical case, we have a 70-year-old man presenting with a right anterior neck mass that enlarged rapidly over the past 2 months. The mass has been causing breathing problems, but he denies any other symptoms. On examination, he has multiple lymph nodes in the neck attached to the tissue below. They feel enlarged, rubbery, but they're non-tender. The rest of the H&P are not contributing. The pre-op CT demonstrates a 5 by 7 well-defined heterogeneous mass with a couple of calcifications. The patient underwent a modified radical neck dissection. Post-op, he developed difficulty swallowing, chewing, and voice changes. What structure was most likely injured? And then they have the option choices: trigeminal nerve, facial nerve, hypoglossal nerve, cervical plexus, and ansa cervicalis. Okay. So I've taken the liberty to highlight everything that I was thinking of that in my head was very pertinent. So we have a 70-year-old man with a right anterior neck mass. So immediately I think of the big C, the worst is cancer until proven otherwise. It enlarged rapidly over the last 2 months. I'm thinking, okay, something really malignant is going on. The mass has been causing breathing issues. So now I'm thinking, what if? The worst case scenario, metastasis to your lungs, metastasis to other areas of the body. But the next section, he denies any other symptoms. So no hemoptysis, he's not coughing on blood, he doesn't have any weight loss, no pain in his joints, pains in the bones. Let's move on. The rest of the H&P are not contributing. Oh, that's interesting. So even though he has a mass, it's not really bothering him, and the H&P isn't really leaning towards that direction either. CT demonstrates a heterogeneous mass with a couple of calcifications. Sure. So the patient has the mass removed. However, afterwards, he has difficulty swallowing, chewing, and voice changes. What structure was most likely injured? So whenever I'm doing these kind of questions, I always take a step back and try to think about it and try to reword it in my own words. So we have an older patient with a right anterior mass that was removed. After it was removed, he has difficulty swallowing, chewing, and voice changes. Therefore, what area was damaged when he removed the mass from his neck? So we're going to go through all the answer choices, and then we'll try to reason out together which option is most correct. So the first one, the trigeminal nerve, cranial nerve 5. This one controls the muscles of mastication or chewing, right? So closing the jaws, opening the jaws, right? So closing jaw from the masseter temporalis, medial pterygoid, and then the lateral pterygoid actually open the jaw. However, if you look at the question 7, the patient has difficulty swallowing, chewing, and voice changes. So this answer isn't the best. It's only doing opening and closing, but nothing else. If we look at the next answer, the facial nerve controls a lot of different areas. So sensory nerve, the anterior 2/3 of the tongue. So the taste of the anterior 2/3 controls the facial opening, eyelids opening and closing, a little bit of a jaw opening as well. But it doesn't control everything we're looking for. Once again, swallowing, chewing, and voice changes. So even though the facial nerve is really, really important for sensory, motor, and motor, somatic, and parasympathetic, is not the best answer for this one question. Hypoglossal nerve controls the tongue, more specifically tongue protrusion. Does it help with swallowing, talking, chewing? No. So the hypoglossal nerve is out. Now the cervical plexus, this one is really interesting. The cervical plexus actually controls 6 large main nerves, and I've taken the liberty to loop them all here. Long story short, it controls so much, but it doesn't really help with the 3 we're looking for. Once again, it's called the swallowing, chewing, and voice changes. The good thing about this being a recorded video is that you can rewatch this one section, learn it on your own. So let's move forward to the correct answer. The ansa cervicalis, right? Ansa cervicalis. Actually, backing up a step, apologize. Whenever I think about the cervical plexus, I think of, Spock, so good old Star Trek. Kind of demonstrates how old I really am. But this is a great image of the cervical plexus with so many nerves in that one area going to so many different locations. So it kind of demonstrates that whatever way helps you remember the what way you can control. So for example, I think of the Vulcan nerve pinch. I think of this area, how many nerves going to all kinds, controlling so many different regions. And the interesting fact is the ansa cervicalis is one aspect that we're focusing on. So going back, I apologize. The ansa cervicalis is the correct answer. So the ansa cervicalis actually controls the motor function of the omohyoid, sternohyoid, and the sternothyroid muscles. Okay? These actually control the tongue, pharyngeal, and laryngeal movement to produce tonal variation. It also helps with swallowing, helps with chewing. So the ansa cervicalis is the correct answer for this question. I've taken the liberty to give you 2 views, the frontal view and the lateral view. So the omohyoid, sternohyoid, thyroid hyoid, and the hyoid bone right here. Right? So if I have to relearn or revisit the question, what takeaways can I get from doing this one question? Well, when I did this question, when Meg was kind enough to have me go through it, so things I could have learned on my own. So the anatomy and physiology of the neck, that's something I could have reviewed, relearned to really help me understand this one question. The cranial nerve location, functions, and palsies. So being able to know all 12 of them, know where they're located, what's their function, if they have a palsy or damage to them, what kind of pathologies will present. At the same time, this 70-year-old patient had an anterior right-sided neck mass. What other things could I learn from this one patient, or what other things could I look into? Well, diseases of the salivary gland, any kind of thyroid nodules or neoplasms, or thoracic outlet syndrome. I'll let you look into that for fun. What is thoracic outlet syndrome? One of my favorite pathologies. And just for fun, I included a picture of the skeleton of a howler monkey. Why on earth would I do that? In my humble opinion, I remember images, I remember stories. So remembering the hyoid muscle, the hyoid bone, and think of all the nerves that innervate that, causing swallowing, causing speech, really helps solidify the information. So on that note, thank you. Once again, my name is Dr. Roland Zhang. I was a former graduate of St. James. Currently, I work for this school as a USMLE counselor. If I made any mistakes, or if you want to reach out to me, please feel free to email me anytime. I've listed my email below. Thank you again for joining us on this beautiful Tuesday. I wish you and your family a happy holidays. I'll see you all next time.
Bye. Thank you guys for joining again. Please join us back on next Thursday for when we have our new question posted on all of our social media platforms. We look forward to seeing your answers, and so the following Thursday, after it's been posted, we're going to go Facebook Live and to go through like we did today, but with more in-depth discussion, and you can ask whatever questions you may like. Thank you so much.
Thank you again.